أعوذ بالله من الشيطان الرجيم بسم الله الرحمن الرحيم رب اشرح لي صدري ويسر لي أمري واحلل عقدة من لساني يفقه قولي السلام عليكم ورحمة الله تعالى وبركاته. First of all, I would like to thank our dynamic brothers and sisters from the UMMA for coming up with this program in preparation for Ramadan. So I am going to talk about the do's and don'ts in meal restriction during Ramadan. Before I begin, I would like to start with a dua. O Allah, make the month of Rajab and Sha'ban blessed for us, and let us reach the month of Ramadan, prolong our life to Ramadan, so that we may benefit from its merits and blessings. O Allah, safeguard us from the month of Ramadan by making us see the month of Ramadan healthy and fit. And safeguard the month of Ramadan for us by making the condition in it such that we can take maximum benefit from it. And accept it from us. O Allah, let us reach the month of Ramadan, prolong our life up to Ramadan so that we may benefit from its merits and blessings. So the holy month of Ramadan is of great importance to the Muslim community. During this period, we Muslims observe fast, and during this time also, the Holy Quran was revealed to our Prophet, beloved Prophet Muhammad sallallahu alaihi wasallam. Fasting is considered one of the 5 pillars of Islam, and this month is known to detoxify not just our body, but more importantly, our soul, and bring us closer to Allah subhanahu wa ta'ala, inshallah. And this month is regarded as a time for spiritual reflection, self-discipline, universal brotherhood, worship, and self-control. So this is also the time that we should be more conscious of our health and the food that we eat. So with that, let's start. So let's discuss first the physiology of glucose metabolism in the fed state. So what happens while we are eating? So after we eat, the blood glucose goes up. And with that, insulin also increases in response to the increased blood glucose levels. So as you can see, there will be glucose disposal by glycogen synthesis, and the stored energy that we have in the liver and in the adipose tissues are not being used. So what happens when we fast? So after, within a few hours of fasting, as the blood glucose falls down, insulin secretion is also suppressed. So when the plasma glucose levels goes down, the counter-regulatory hormones such as the epinephrine and the glucagon increases, and during this time, this will cause hepatic glycogenolysis to maintain blood glucose level within the physiological range. So as the fasting progresses, with a progressive rise in glucagon and the epinephrine, the glucose metabolism switches to a combination of glycogenolysis and gluconeogenesis. So during this time, our body makes use of the stored energy that we have in the liver and then in the adipose tissue. So there is what we call the metabolic switch. Now let's look at more into details on the benefits of this metabolic switch. So accordingly, this metabolic switch causes an alternative fuel. This becomes an alternative fuel in the brain, which increases plasticity, performance, and increased disease resistance. In the muscle, this improves lean body mass, enhances muscle growth, recovery and endurance, reduces inflammation. What about in the liver? This increases insulin sensitivity, reduces lipid accumulation. In the intestines, it enhances motility, reduces inflammation. In the cardiovascular system, this reduces blood pressure, heart rate, increases parasympathetic tone, and in the adipose tissue, this reduces leptin production, also reduces inflammation, and reduces blood glucose, insulin, leptin, and increases adiponectin as well as reduce inflammatory cytokines. So fasting has a lot of benefits. And also, let's look into the health issues. What are the health issues during Ramadan? So accordingly, we have several issues such as eating particularly large meals at iftar. So eating significant amounts of highly processed carbohydrates and sugar. So we will know what happens if we keep on eating these highly processed food. Eating desserts loaded with sugar after iftar. We are going to discuss more in details in a while. So having large and frequent snacks between the two main meals. Eating at a fast speed. What is the sunnah on how we eat? And fast eating could usually lead to overeating. Now, eating suhoor early, which may result in hypoglycemia after iftar, and consumption of large portions of high glycemic index carbohydrates at suhoor. So before we proceed, let us try to check what did the Prophet Muhammad sallallahu alaihi wasallam eat for iftar. Anas bin Malik, may Allah be pleased with him, said, the Prophet Muhammad sallallahu alaihi wasallam used to break his fast with fresh dates before he prayed. And if he did not find fresh dates, then he would use dried dates. And if he did not find that also, he drank few sips of water. So as you can see, our beloved Prophet usually break his fast with food that are easily available, and he usually follow a simple diet. And our Prophet Muhammad sallallahu alaihi wasallam did not indulge on his appetite. He doesn't have that tradition, so which give us his ummah plenty of food for thoughts if we indulge too much on our appetite. So how should we break our iftar? We should break it gently with dates, warm soups, or bone broth. So this will replenish our body with fluids and will prepare the digestive system for the meal, and as well as provide nutrients. So let's look into this hadith on the amount of food that we should be eating. Our Prophet Muhammad sallallahu alaihi wasallam said, "The offspring of Adam fills no vessel worse than his stomach. Sufficient for the child of Adam are a few morsels to keep his back straight, and if he must eat more, then a third should be for his food, a third for his drink, and a third left for air." So our religion encourages us to eat moderately. So what happens if we overeat, if we eat too much? So there are consequences. So this promote excess body fat and insulin resistance. So this could contribute to the extra calories in our body, and they will be stored by our body as fat. And they may also disrupt hunger regulation in our body. So there are actually two hormones that are responsible for hunger regulation. So we have the ghrelin, which is responsible for our hunger, and the leptin hormone, which suppresses that hunger. So if we eat too much, this will cause a disruption in this balance, and it would be difficult for our body to determine if we actually need food. And this could also increase disease risk. So overeating would promote obesity and insulin resistance. So these are the two major factors for metabolic syndrome. Metabolic syndrome is a cluster of condition that increases our risk for heart disease, for diabetes, and stroke. So over time, overeating may also harm our brain function. And there are several studies that says overeating and obesity could lead to mental decline in older adults compared to those who do not overeat. And there are also studies which show that overweight negatively affects memory compared to those persons with normal weight. So, in addition to that, overeating could also make us feel nauseous. So, oftentimes, after we eat our iftar, if we eat too much, that would make us dizzy and nauseous. So, what happens? So, the adult stomach is approximately the size of a clenched fist, although it could expand after we eat. But then, if we eat too much and start to reach the upper limit of our stomach's capacity, we may experience nausea or indigestion. And in severe cases, this may trigger vomiting, which is the body's way of relieving acute stomach pressure. So while there are over-the-counter medications that treat these conditions, the best approach is still to regulate our portion sizes and eat slowly to prevent the symptoms in the first place. So overeating may also cause excessive gas and bloating. So there are certain foods that are prone to give us more gas and bloating, such as spicy and fatty foods, especially the carbonated drinks like soda. So we should avoid them. And also, if we eat too fast, so the large amount of food will be rapidly entering our stomach. So this could also cause excessive gas and bloating. And of course, we may experience this at times. Overeating will make us feel sleepy. So this could be um, due to a phenomenon what we called as reactive hypoglycemia, wherein if we overeat, the blood sugar in our body drops suddenly, and then we feel that low blood sugar is usually associated with sleepiness, sluggishness, rapid heart rate, and even headaches. So I think that's enough for us to consider. If you don't want to feel all those symptoms, then might as well we should avoid overeating when we break our fast. So what should a healthy iftar consist of? So it should contain whole wheat and whole grains. So this whole wheat contains and whole grains contain fiber that help us feel full, thus decreasing our intake of food. And fiber can also reduce the insulin stimulating effects of carbohydrates, making it one of the main protective factors against obesity. We should also have carbohydrates in the natural, whole, and processed form. So higher carbohydrate intake alone does not necessarily lead to higher insulin levels, but the refining and the processing is the leading role in enhancing the insulin effect. So if we remove the natural fiber, the fat and proteins in the food, then we are at stake for a lot of diseases. So processed food increases the speed of digestion, which result also in higher blood glucose levels. So at the same time, if we eat more refined carbohydrates, because the feeling of being full from the effect of the protein fiber have been lost. So we tend to eat more. So moderate protein consumption. So protein is also vital, and our body digests protein more slowly than carbohydrates. That's why protein can help us feel full for a longer period of time. And protein also changes the level of hormones that control our appetite. It reduces the production of ghrelin, the hormones which tells our brain that we are hungry, and it also increases the level of hormones that tell our mind that we are full. So, of course, you should also don't overdo it a lot of protein, because remember, our body will still break down this excess protein into sugars through a process called gluconeogenesis, which causes our body to release insulin and signals it to store fat. So how about fats? Yes, we should be consuming natural fats. Dietary fats are actually essential to give us our body energy and support a lot of cell functions. And they also help protect our organ and help keep our body warm. So fat also absorbs some of the nutrients and produce important hormones. And of the three macronutrients, the carbohydrates, protein, and fats, the dietary fats are the least likely to stimulate insulin. And it also adds more flavor to food. So the key here is to use higher proportion of natural fats. So avoid the processed one. Avoid highly processed vegetable oils. So we should also increase our fiber in the diet. So fiber can reduce the insulin stimulating effect of carbohydrates, making it one of the main protective factors against obesity. So soluble fiber reduces carbohydrate absorption, which in turn reduces blood glucose insulin level. So high fiber food requires more chewing from us and reduce the food intake. So fiber also backs up food and decreases its energy density. And because of increased bulk, this also means that the stomach takes more time to be empty. Therefore, after a meal that is rich in fiber, blood glucose and insulin levels rises slowly. So what are the meals that we should avoid? We should reduce the consumption of added sugar. So sugar stimulates insulin secretion. It also increases insulin production, both immediately and over the long term. So over time, insulin resistance leads to higher insulin levels. So sugar, whether naturally occurring or added, should be taken occasionally. So the key word here is occasional, and it should not be taken frequently. We should also reduce the consumption of refined grains. So again, refined grains or carbohydrate increases blood sugar or glucose higher and faster than the unrefined ones. So the refined grains such as white flour, the white rice, stimulate insulin to a greater degree than virtually any other food. So the toxicity in food stems from the processing rather than the food itself. So these simple carbohydrates are easily digested, thus elevating our blood sugar levels and making us more prone to hunger. So what about having large and frequent snacks between the two main meals? So this is one of our favorite during Ramadan. So, but if we take in um, too much portion or if we snack frequently, so this could add again to the excess calories that we have and eventually would lead to weight gain in Ramadan. So we should also be eating slowly. So slowly eating will help us eat less food and improve our digestion. And it is a practice our Prophet Muhammad sallallahu alaihi wasallam did himself and strongly advocated. So we know that it takes about 20 minutes to send signals to our brain that it is full. So eating slowly is recommended for health. And slow eating also helps chewing the food well. So this result in the exercise of our jaws and mixing of the saliva with food. Hence, it is efficient. It would cause or enhance better digestion because the food particles are cut also into smaller pieces. So it would require less, shall we say, stress for the stomach or intestine. So let's talk now about suhoor. So the Prophet Muhammad sallallahu alaihi wasallam said, the suhoor is a meal of blessings, so do not leave it. Even if you just take a gulp of water, as Allah sends mercy and His angels seek forgiveness for those who take suhoor. So Allah has permitted the fasting person to eat and drink until the dawn comes, according in Surah Baqarah, the Most High says that we can eat and drink until the white thread becomes distinct from the black thread of the dawn. So what should we be eating in suhoor? So just like during iftar, we need complex carbohydrates. So a healthy suhoor should consist of complex carbohydrates, which take a long time to digest, which essentially means that it will provide our body with the energy for a longer period of time. So we won't get hungry easily. And this good type of carbohydrate will also keep us active throughout the day. So complex carbohydrates are found in usually brown rice, whole wheat bread, potatoes, corns, and oats. So by the same token, we should not also be consuming large amount of simple carbohydrates such as white rice, white bread, or the sugar, because these simple carbohydrates are easily digested, thus elevating our blood sugar levels and making us more prone to hunger. So food like this should be avoided by us, especially during fasting. So we also need fruits and vegetables. So apart from the complex carbohydrates, it is also advisable to eat fruits and vegetables during suhoor because they contain lots of fiber, and the consumption of this will help us be full for a longer period of time, and this will also prevent constipation. And they also contain lots of vitamins and minerals which are good for the body. And of course, we recommend that we take in whole natural food instead of the ones in cans because the nutrient content of those in cans are significantly reduced already. So we also need proteins. So intake of proteins such as skinless chicken, fish, legumes, beans, is helpful in keeping us full or satiated for longer. So in addition, protein is also a vital component in repairing and rebuilding our body tissues as well as increasing our body's immune system. And consuming dairy products that are also high in calcium would also help us strengthen our bones. And of course, the last but not the least, we also need water. So make sure to drink a good amount of water to keep yourself hydrated and avoid excessive thirst throughout the day. And of course, avoid sugary water or the soda or bottled juices that are high in sugar because not only they are healthy, they will also make you feel thirsty. So let's look at the example of a Ramadan plate, although this varies according to an individual's daily calorie target. So in this plate, we could see a balanced diet with the inclusion of carbohydrates, proteins, and fats on this meal. So we should not disregard the vegetables and the proteins in our diet. And the presence of fruits as well. So in summary, let's take a look at the 10 principles of Ramadan nutrition. This is from the DAR International Alliance Practice Guidelines in April 2016. So the total daily calories divided between suhoor, iftar, and with 1 to 2 snacks. And the meal should comprise of a balanced amount of there should be balance with the inclusion of important macronutrients such as carbohydrates, fats, and protein. And we can use that Ramadan plate for designing our meals and avoid sugar-heavy desserts in between meals. And also, we should take a moderate amount of healthy dessert, which is permitted, and select carbohydrates with low glycemic index. We should also maintain an adequate hydration by drinking enough water and take suhoor as late as possible, especially when fasting for more than 10 hours, and consume an adequate protein and fat at suhoor as food with higher levels of these macronutrients and lower levels of carbohydrate have a lower glycemic index than carbohydrate-rich food. And iftar should begin with plenty of water to overcome dehydration from fasting and 1 to 2 dried or fresh dates to raise blood glucose levels. So if needed, a snack of 1 piece of fruit, a handful of nuts or vegetables may be consumed between meals. So that ends my lecture. And before I go, I would like also to make a dua for us. Ya Allah, increase us in gratitude towards you alone. Grant us softness in speech. Protect our tongue from lying, backbiting, hurting others. Ya Allah, grant us beautiful patience and obedience to you. Help us see our faults and cover them from others. Allow us to speak with wisdom, just like the Prophet Muhammad sallallahu alaihi wasallam. Help us to be courageous, confident, and a positive person who makes the correct decisions at the right time. Ya Allah, help us to say words of truth in the face of the mighty. Ya Allah, protect us against the evil of our tongues and lead us to the best character. Ya Allah, do not take away our happiness when you bless us with wealth. And when you bless us with might, do not take away our wisdom. And when you bless us with success, do not take away our humility. And teach us to love others as we love ourselves. Teach us to judge ourselves as we judge others. And teach us that forgiveness is one of the greatest steps towards strength. Ya Allah, forgive our transgressions of your commands. Grant us a victory over our shortcomings. O Allah, help us conquer and stop our bad habits of eating and talking too much. Ya Allah, please don't let us forget you in this dunya. Keep guiding us, our steps back to you. Grant us a heart filled with tranquility, peace, and we beg that you do not exclude us from your compassion. Amin, inshallah. With that, thank you so much for your kind attention and for listening. And I wish you all a blessed Ramadan and wish you all a happy, safe, and blessed Ramadan. Assalamu Alaikum wa rahmatullahi ta'ala wa barakatuh.